We want to hear your views about some changes we're considering making to how you collect and reflect on feedback from your patients as part of your revalidation. Many doctors say that this type of support and information can be the most valuable for their learning and development, but we also hear that it can sometimes be challenging to collect.
Patient feedback is normally quite a good thing. It might not always be very pleasant, but I found it quite useful as a learning tool.
We want the feedback you receive from patients to be meaningful. It should aid your professional development and support you in understanding what patients think you do well and where you could improve.
Regular patient feedback is one of that fundamental things that will help you in continuously trying to improve yourself.
The changes we're consulting on include allowing you to collect feedback in a way that works for you and your patients, asking you to reflect at each appraisal on any spontaneous or unprompted feedback that you've received.
I think patients should be allowed to give feedback in any way which is comfortable for them.
It could be really helpful if there was feedback forms always in the reception with a pen ready, so you can just leave a quick note.
We know how much pressure you're under. That's why it is important that any changes we make in the future work for you, your patients, and the healthcare system.
I think more flexibility in gathering feedback would probably be quite useful, especially in areas where the patient population is slightly more challenging to approach. So if you're working with homeless patients or asylum seekers, where they're not necessarily going to respond very well to either an email form or a paper form.
I think what we need to do is perhaps embrace technology a bit more. I'm sure there'll be lots of innovative ideas. The generation's changing, people are using, everyone's familiar with their smartphone, internet, apps.
Please share your views by completing our consultation by the 23rd of July 2019. We really want to hear what you have to say.